Berdasarkan rekod Kementerian Kesihatan Malaysia, seramai 1,856 pegawai perubatan dan 1,754 jururawat lantikan tetap telah meletak jawatan dari tahun 2020 hingga 2024. Ya. Dalam tempoh yang sama juga, KKM telah melantik tetap seramai 13,349 pegawai perubatan dan 8,121 jururawat terlatih atau staffless. Antara perkara yang atau langkah-langkah yang telah dan sedang kita laksanakan adalah antara lainnya, satu, yang meningkatkan perjawatan bagi melantik tetap pegawai perubatan kontrak, dan sejak tahun 2023 hingga kini seramai 13,552 pegawai perubatan kontrak telah ditawarkan.
The government must develop a long-term plan to address a critical shortage of nurses, says the International Council of Nurses. The council CEO, Howard Catton, said Malaysia's shortage has been exacerbated by high-income nations hiring nurses from Asia with better pay and working conditions. Catton said a decade-long plan is needed with a focus on better wages, working conditions, safety and career prospects in order to attract and retain talent. Catton said the plan should aim to bring nurses' salaries, currently ranging from 2,600 ringgit to 3,800 ringgit in public hospitals, closer to the national average monthly salary of 6,610 ringgit. He also called for greater investment in the nursing profession and in health workers.
Poor care, where there is harm done to people in countries, is estimated to cost countries as much as 10% of GDP when you don't deliver great care. When you do invest in healthcare, you keep people healthy, you keep them working, you keep them engaged in society. So you also, the evidence shows, there's an economic boost through investing in health care.
Assalamualaikum warahmatullahi wabarakatuh. To Malaysia, Dr. Idris Osman. Today I would like to share my finding on a current issue regarding recruitment and selection. My topic is nurse shortage in Malaysia public healthcare industry. Before I start, let me introduce myself. My name is Siti Nisa binti Muzamel from class B A2733B. For the introduction, a staff shortage refers to a situation where the number of available workers is insufficient to meet the operational needs of an organization or sector. In Malaysia's healthcare system, staff shortage has become an increasingly serious issue, especially among nurses who form the backbone of patient care in hospital. Recent news report revealed the scale of this problem. The Minister of Health MOH announced that Malaysia is currently short of 43,243 nurses nationwide, a gap that has strained public hospitals across the country. Over the past 5 years, 1,755 nurses have resigned from government service, while more than 3,000 Malaysian nurses have left to work overseas seeking better pay, lighter workload, and improved career perspective. Now we move to the factor of staff shortage in healthcare industry. One of the main contributors to staff shortage in the healthcare industry is the high workload faced by nurses and healthcare workers. Many hospitals are understaffed, which force existing staff to manage more patients than the recommended nurse-to-patient ratio. Long working hours combined with the pressure of handling critical cases create a stressful working environment that can quickly lead to burnout. As highlighted in the recent report, staff shortage leading to higher workload burnout, demonstrating that overworked nurses often resign to protect their mental and physical well-being. The cycle of overwork and resignation further intensify the shortage problem, making it difficult for hospitals to maintain adequate care standards. Another factor driving healthcare staff shortage in the migration of skilled professionals to other countries, commonly referred to as brain drain. Over 3,000 Malaysian nurses have left to work overseas in countries like the UK, Singapore, and the Middle East, attracted by higher salaries and better benefits. According to the Health Minister, Malaysia cannot legally prevent healthcare worker from pursuing opportunities abroad, which highlights strong pull factor from higher paying countries. This migration that only reduce the number of experienced professionals in the local healthcare system, but also create gap in the critical hospital service, particularly in public hospitals struggling to fill vacancy. Low salary relative to the workload is another factor causing healthcare staff shortage. Local nurses often receive compensation that is considered insufficient, especially when compared to the private sector or overseas opportunities, such as in Singapore. This disparity creates push factor, encouraging healthcare workers to leave public hospital for better paying position elsewhere. The combination of heavy workload and comparatively low pay leads to dissatisfaction and high turnover rates, further exacerbating the shortage and challenging in Minister of Health's effort to maintain adequate staffing level. Now we move to solution to reduce staff shortage in healthcare industry. Firstly, fast-track recruitment. One of the solution highlighted by the Minister of Health (MOH) is the fast-track recruitment of healthcare workers, especially nurses, to quickly reduce manpower gaps in public hospitals. The Health Minister announced an urgent plan to hire 4,355 healthcare workers, including nurses, through an accelerated process to ensure hospital receive staff without the usual long administrative delay. This fast track is crucial because many public hospitals are currently overwhelmed with rising patient number and cannot wait for lengthy hiring cycle. By speeding up recruitment, MOH aims to ease the workload of existing staff, prevent further burnout, and stabilize hospital operations that have been strained by years of understaffing. The second one is offering permanent position to contract staff. Retention is another critical component of solving the nurse shortage, especially because many nurses under the contract system feel uncertain about job security and career progression. To address this, the government has begun converting contract nurses to permanent position, giving them stable employment, access to benefit, and clearer promotion pathway. This move is important because job security is one of the main reasons nurses resign or move abroad. By offering permanence, MOH hope to retain experienced nurses, reduce turnover, and ensure a more stable workforce. This long-term stability is essential for improving patient care and preventing further shortage in the future. Last solution is incentive and improve working condition. Although still in discussion stage, several articles indicate that MOH is exploring incentive and improvement to working conditions as part of long-term retention strategies. These include reviewing workload distribution, considering special allowance for high-demand area, improving shift system, and upgrading workplace facilities. Better working conditions are essential to reduce burnout, increase morale, and make public healthcare job more competitive compared to private and overseas opportunities. This effort aims to address both the physical and emotional challenge faced by nurses, ensuring that more of them remain in the public system. In conclusion, Malaysia ongoing nurse shortage reflect the structural challenges within the healthcare system, where demanding workload, limited rewards, and the continuous loss of skilled workers have created the cycle of burnout and rising resignation. Public hospitals are struggling to cope with increasing patient loads, making it difficult to maintain consistent standard of care. In response, the government is working to strengthen the workforce through quicker hiring, greater job stability, and long-term improvement in working conditions. This combined effort aim to restore balance, reduce pressure on frontline staff, and build a more resilient healthcare system capable of supporting both worker and patient effectively.